In this lecture, we are going to discuss trigger points and their treatment. This is one of our neuromuscular techniques. There are lots of books available on the topic. There are even a pair of books by Travall and Simons that map many of the common trigger points and the pain patterns they create. This is a specific treatment compared to many we are looking at, and it is designed solely to treat trigger points. Trigger points are generally only the size of a pea, but the trouble they can cause is huge. A trigger point is a hyper-irritable spot within the muscle. This will cause localized and referred pain, reduction in muscle function such as weakness and reduced range of movement, and localized muscle spasm. There are many causes for trigger points such as muscle imbalance, overuse, compensatory movements, and injuries. So what actually happens? It starts with a local metabolic crisis involving the actin and myosin within the myofilaments. So we're not looking at the whole muscle here, but actually down to the fine detail. This creates a localized spasm, which will leave the rest of the unaffected sarcomeres in stretch. This creates a taut band, which can help to temporarily stabilize the affected tissues. So this is the body's way of trying to protect itself and continue to function in the best way it can. This will lead to local and referred pain and limited range of movement. There are a couple of key giveaways here which will help you decide if it is a trigger point, alongside using obviously your 10-second press test. The first is the taut band. There will always be your taut band, and that trigger point will be somewhere along that band, and it will be palpatable. So you'll be able to palpate the band and then find within that the trigger point. So this will help you a great deal to narrow things down. The other useful clue is the referred pain. This is very common with trigger points. So when you press on, or when you do your press test, always ask your client if the pain is referring from that central point. Before you go ahead and release a trigger point, you need to consider why it's there. It could be old and no longer required for the role the body created it for, so it's fine to release. It could be helping to stabilise a joint with a current issue. So how do you deal with it here? Well, first of all, you need to see if there is any underlying problems. So that comes with your subjective history. Does somebody have a joint problem that they've not really come about, but they've come about the pain from the trigger point? Then you'd need to address both issues. So what you can do when dealing with an active trigger point is to ensure that you give your client the right rehab and aftercare advice so that you could go ahead and treat the trigger point, but they would need to do some work themselves. The other option is you could leave it alone, which isn't going to really help the client because they're in a great deal of pain. And if you give them any rehab, it's likely to be ineffective, or they're not likely to do it because they're going to be uncomfortable. So your third option here is actually to partially release it or desensitize it. This will help to make your client more comfortable, leaving the stabilizing factors in place, but without that massive overreaction that the body is renowned for. But then you need to give them some rehab and make sure that they come back for more treatment. So you'd have to have quite a lengthy conversation with your client about this to make sure they understand exactly what they need to do and why you're doing what you're doing, and make sure that they're happy with that. The other thing is, if you do release a trigger point, either partially or fully, and the body still needs it, all it's going to do is recreate it. So if you go ahead and release it, they might find some instability in that joint for a short while, but the body will put back in its safety net. So there is that option as well. But really, you don't want to leave the client in that position where they're fighting two different things. So really understanding what's going on here is quite important. I generally, where possible, aim to completely treat a trigger point, but I will look at other issues that are going on and discuss things like previous injuries, because it could be an old injury that's a problem, or an old break or something like that that's not quite right. So I will discuss other things, but normally I'm compelled to completely release a trigger point. So back to the trigger point itself, by altering the chemical cycle within the affected sarcomeres, we reduce and release the taut band created. This can be done by direct pressure, so trigger points, or trigger point release, should I say, or compressions, which you've done in your level 3, stretching or icing, or even a combination of all of them if some trigger points can be tricky. When you carry out a trigger point release, we are actually starving a small area of tissue from blood and oxygen, and this is called an ischemic pressure or myotherapy. The effects of trigger point therapy is increased flexibility and contractibility of the affected muscle, which in turn will improve range of movement, local and referred pain will be reduced, and local circulation will improve, and there will be a local and general relaxation from this form of treatment. Before you embark on trigger point release, you need to advise the client it may leave bruising, and it may feel bruised but isn't, so some discomfort but not like the original trigger point itself. You will obviously need, as always, to get consent to treat. So as far as I'm aware, I've never bruised a client but will often leave that bruised feeling behind because you have been you've worked those tissues very intensively. So how do we go about performing trigger point therapy? So you start with your 10-second press test. Remember, you also have the added knowledge that you have the taut band present and the trigger point within it somewhere. You also know that there is more than likely going to be referred pain. Once you've decided you have a trigger point, make sure your client is in the most comfortable position they can be and in the most accessible position for the treatment you need to do. And also that you're in a good position to treat. You could be there a long time. The other thing you need to remember is not to lift your fingers off after the 10-second press test. So it's probably worth considering these factors before you actually do your press test. So have your client in the right position before you start deciding how you're going to treat it. It's important not to lose contact with that point, because once you do, you'll have desensitized it slightly, so it might be harder for you to find. So there are a couple of methods you can use here. One is pulsing and the other is a steady pressure. Usually steady pressure is my preferred approach. However, if it's a little stubborn or the client's particularly sensitive, I may use the pulsing method, or I might actually blend the two together. The first method is direct constant pressure. So you apply pressure till you reach a scale of 7 out of 10 on the pain scale, and you hold it there. The pain will start to decrease in the local area and the referred pain will start to recede back to that localized point. You can then go in deeper to bring it back to a 7, and then you sit there and wait. And you keep doing that for as long as you can, or as long as you can get it back to a 7 out of 10. I was taught by a physio to do this techniques, and I treat as long as I need to. I don't limit it to 4 minutes or whatever. Obviously, I need to be aware, or you need to be aware, that if it's taking a really long time, then it might be something that's actually better coming back to, or you might just need to be a little bit persistent. It comes with practice, and you will figure it out as you go along. You also want the pain to diminish as far as possible. So you'd really like it to go completely, but if not, to get it back down to sort of 1, maybe 2 at the most. It's then important to stretch the localized tissues and also flush the area really well. The second method is the same as the first method, so you go to a pain point to 7, but this time you only hold for 5 seconds, and then you just release the pressure off slightly for 2 seconds and then go back in for 5, going to that pain point to 7. This can be a little bit tricky, and because you've only got 5 seconds, you need to be quite accurate to how deep you're going with your pressure to get back to that 7. So it's a little bit more tricky, but it can be effective. But remember not to release completely. And as I've already said, you can alternate between the two. So you could use a steady pressure and then a pulsing pressure. You can use knuckles, fingers, thumbs and elbows. Just remember to reinforce joints and also to stabilise things like elbows, because you don't want them to go skittering off across the muscle and losing your trigger point. Some people will use tools, and I don't honestly think this is the best idea. This is a personal thing, but I don't really recommend them. You will lose a lot of sensation. You will struggle to know what's going on underneath the tool, and that's really important information that you're getting, because you do get all sorts of feedback through your fingers when you're treating, especially with trigger points. When treating a trigger point, you will often feel reactions under your fingers, as I've just mentioned, and these can be all sorts of things. So you might feel a heartbeat develop. So like a regular pulsing. This isn't a heartbeat, it's a reaction to the trigger point that's trying to release. If you do go in straight away and get a heartbeat sensation, then you actually are on an artery and you do need to come off and move. You may get like a fluttering under your fingers, and this is quite an odd one. It just feels like ripples or fluttering underneath the tissues. You may feel the muscle trying to push you out. This is when it's being difficult and stubborn. So in this case, I slightly reduce my pressure. So I know I'm coming away from that 7 out of 10. It's not a hard and fast rule, but it's a starting point. And sometimes you just need to be a little bit more gentle with them just to get them to let go. You may also just feel it disintegrate under your fingers, and that's fantastic. That one's really, really satisfying because you know it's gone. So these are your main ones, but you'll feel all sorts of different responses when you're treating. Also, when you're treating a trigger point, keep an eye on the tissues in the surrounding areas because you may see reactions, sometimes fluttering or pulsing in the vicinity. You can get red flushes come up as well, completely further away from where you're treating. It's quite weird to see that. And this may indicate that there's another area that needs treating. So when you've finished with your current trigger point, you can go and check out these areas and see what's going on. It may be that it's like a satellite trigger point, a secondary trigger point, or just a sore point that needs treatment. So by keeping an eye out and actually treating these areas, you will get a much better result for your client. I've said many times with treatment that you should warm an area up first. However, with trigger points, if you warm the area up first, you will desensitize that trigger point. And this may make it harder to locate and treat them effectively. So in this case, and if you suspect trigger points, I generally don't warm up the area. I deal with the trigger points first. One last thing before we move on to the demonstrations, your body maps on your consultation forms are really, really useful with trigger points. Rather than trying to explain a trigger point, you can just make a dot on your body map, and if you've got several, you can number them. So you just put like TP1, TP2, and then you can put that in your notes and write anything useful that you felt, or you know, if you didn't feel that you'd finished the trigger point, or if you felt that it released completely. But also then when your client comes back, you're able to sort of locate it much more easily. And even though they might not have the symptoms because you've really got or nearly got rid of it, you might find that there's still a little residue there that you want to just finish off. So this is a really good way of mapping your trigger points. So now you've completed the theory of trigger point release, you can go ahead and complete the quiz associated with this section, and then you can move on to the demonstration of trigger points. There is only one video for this because it is exactly the same wherever you do a trigger point. It's not going to change. So there's only one video. It is technically a simple treatment. It's just the hard part, or the learning part, is actually understanding how it's responding under your hands. So have a look at your demonstration and then have an experiment.